acute myeloid leukemia. So what happens? The patient of middle age. So in AML, the M, remember it with middle age. The patient, middle-aged man, comes to you with an acute onset of fever, gum bleeding and the bone pain or the sternal pain. And the blood picture shows WBC count increased and the platelet counts are decreased. And the bone marrow has greater than 20% of the blasts. Coming to FAB classification, it has M0 to M7. So the first three are undifferentiated, without maturation, with maturation. And the next three are promyelocytic, myelomonocytic and the monocytic. And the next two are for the M6, remember RBC, right? So acute erythroleukemia. For M7, remember platelets, which you can resemble with acute megaloblastic leukemia. So now from M0 to M7 we have AML undifferentiated, AML without maturation and with maturation, AML promyelocytic, myelomonocytic, monocytic, acute erythroleukemia, acute myeloblastic leukemia. Now coming to WHO classification, it is again divided into 4 types. One, the AML with genetic aberrations. It includes translocation of 8 and 21. The another is AML with myelodysplastic syndrome. That means the person got affected with MDS before. And the AML therapy related. That means if the person got treated with chemotherapy or radiotherapy, then he develops AML. It is AML therapy related. And AML not otherwise, which includes the FAB classification we just talked about, M0 to M7. Coming to the prognosis of different types of AML. For the first, which includes genetic aberration, it has favorable prognosis. MDS has a poor prognosis. Therapy related is a very poor prognosis. And FAB classification, that means AML not otherwise, have an intermediate prognosis. Etiology. It is due to the suppression of TP53 gene and decrease in the regulatory or the maintenance epigenomes. And also mutations in T8 or 21 we just learned earlier, right? So inversion of 16th gene or translocation of 15 and 17. Just remember these numbers, T8, 21, inversion of 16. And also smoking and radiation can also cause this. Coming to bone marrow picture, as it is an acute myeloid leukemia, you can see increase in the myeloid series of cells. That means other cells are decreased, right? Like RBCs, platelets get decreased. So decreased erythropoiesis, decreased megakaryocytes are seen. And the bone marrow is hypercellular because it's a leukemia. And greater than 20% of blast cells are seen in acute conditions. And marrow fibrosis can also be seen. Or rods is a specific feature for AML. Remember it. So or rods seen in case of myeloblast cells. In the beside picture you can see this myeloblast having a small rod-like structure towards the periphery. This is or rods. The blood picture, anemia is seen, which is normochromic. Neutropenia, again it is a myeloid leukemia, right? So only myeloid cells are increased. Another neutrophils, platelets, RBCs are decreased. So you can see neutropenia. That means the patient is more susceptible to infections. Thrombocytopenia, bleeding occurs, and myeloblast have OR cells. Remember this point, myeloblast have OR cells. Coming to clinical features, again anemia leads to fatigue and weakness. Neutropenia leads to fever and frequent infections. Opportunistic infections can occur. Thrombocytopenia leads to bleeding. That's why the patient comes with gum bleeding, swollen gums. Sternal tenderness and bone pain are also seen. And in case of APML, disseminated intravascular coagulation has high risk. The AML is a neoplasia of blood, WBC cells, right? But in case if the AML patient presents with a localized soft tissue mass, it is called as scleroma. In the cytochemistry, the PA stain positive, myeloperoxidase stain is also positive. So often in some questions it will be given as myeloperoxidase stain positive. It is only seen in AML. Myeloperoxidase stain is negative in case of ALL. And Sudan plaque also positive in case of AML. So this is about AML.